Hello, my name is Addie Dawn. This is my first video for YouTube, and I want to respond to some of the videos that I have watched regarding individuals' experiences in psychiatric hospitals. And I've heard varied individuals speaking on varied experiences, so I'd like to respond to that from the standpoint of an individual who works in the psychiatric field and has been involved in that field for over 20 years. And I have worked in psychiatric hospitals, and so I know it from the other side of the desk, so to speak. And what I want to tell you is that I live in Philadelphia. That much I will reveal, of course. And the point is that in a psychiatric facility, usually the first way that you have entry into the system is by way of either an emergency room or a crisis response center. And here in Philadelphia, we have 5 crisis response centers located in different parts of the city, pretty much providing the needs of the individuals who are located in various parts of the city. Usually what will happen is the primary reason for psychiatric intervention and hospitalization is either you have had suicidal ideations with a plan, or you have attempted suicide, or you're homicidal and need to be committed, or you are having some exacerbation of your mental health disorder that is causing problems where you need to have a medication change or to be medicated, and that needs to be done in the confines of a safe environment. Let me start by saying the emergency room or crisis response centers take hours until you get into the unit. That will take hours. Maybe in some areas, rural areas, it's fast, but in cities, it's going to take, no joke, about 8 to 12 hours or more. And what is happening in that process is they're basically doing admissions paperwork. They are giving an assessment by the nurse, by the psychiatrist, by a case manager. They're getting your insurance verified, which takes a very long time. And what I'm going to do is that since YouTube has a megabyte limit or a time limit, I am going to try not to speak too long on a particular topic and then move to another topic perhaps in another video. So I'll have to look over every so often to see how many megabytes I have left. But I'll speak first on the Crisis Response Center. That's what happens. Basically, you're in there with a lot of other people, so it takes time. Once you are admitted, at least at the hospitals where I have worked, you are then put in a locked area. Not a little locked room, like a little area that is locked. It's a secured environment. And then you would go to the unit, and when you arrive on the unit, the person who brings you to the unit does the handoff, which is handing your chart to the nurse. They will then do your vitals and other assessments that they have to do, and probably during the course of your time in the hospital, you're going to have numerous people coming to you and wanting to do assessments with you. Yes, it is true that in some crisis centers, they will have a metal detector, they will wave a wand over you, and they will take away anything that's metal. They'll take your belt. They'll take anything that you can harm yourself with. It is advised that you bring luggage, because you do not know if you'll be admitted or not. Now, if it's a crisis situation, suddenly it just happens somewhere and you're brought to an ER or a crisis center, you know, if you have family that can bring things to you, that's great. But if you're in a situation where you're alone and you can't, then the best thing to do is to bring your own items with you. Now, they will go through your items. Razors will be taken away. Like I said, belts, cell phones are removed from you. If you have an iPod type of instrument, they take that because the headset has wires. So these things will be taken from you. They are not doing this to punish you. They are not doing this to be punitive. They are not doing this to control you, which I've heard other people say. And as I've listened to some individuals, I'm aware that they have bipolar disorder, schizoaffective disorder, schizophrenia, so I realize that a lot of times with these disorders, individuals tend to have certain delusions or certain thoughts that are not necessarily the point. Different psychiatric hospitals work differently. The ones I've worked in have not been punitive to the patients. And they do have to take these items because it's for your safety. And let me say this, the #1 mission of any psychiatric facility is safety. You will hear that word said more than any other word the entire time you are there. And the reason that the units are locked is for your safety. They don't want anybody getting to you, and they don't want you getting to anybody, because you might harm yourself or another person. So I'm pretty much giving you the beginning stages. What happens when you get to the crisis center, all the assessments you'll go through. You'll have to give a urinalysis because they want to see if drugs are inducing your problem. You know, once you're on the unit, you'll give blood work because they want to get baseline blood work to see, you know, your health. So I think at this point I'm giving a lot of information just on the crisis. And in the next video, I will then explain what happens once you are on the unit, what happens in a typical day on the unit, and then I will probably do a video on what the actual personnel that work there, the staff, what they're actually doing and why they're watching you, why they're doing the things they do. And again, I say it over and over, it's for your safety. It's not to harm you. It's not to be punitive towards you. And I'll try to remember to talk about restraints and seclusion, because they are trying more and more to do away with that, because it basically takes up too much staff time, to be honest. It's something as a last resort. They do not like to do that. They do not want to do that. It is a pain in their neck. They don't feel like sitting there and watching you for hours. And it's not hours, by the way. I can explain that too. But the megabytes are just about gone, so let me stop this video and I'll go on to the next one.